I am the head of Department of Nursing at the Faculty of Health Sciences at the University of Johannesburg. I am the chairperson of U21 HSG, Nursing and Midwifery Discipline Group, and I will be the moderator for this prestigious event. It is my great pleasure to welcome all students and staff from different universities who managed to join us as we celebrate the 2024 International Nurses Day and International Day of the Midwife. Amongst us, we have 6 speakers who are ready to share their thoughts with us as they present under the theme, Nurses and Midwives of the Future. What excites you about the road ahead and contribution you can play towards a sustainable world? Colleagues, it might be difficult for us to understand the issues about the future of nursing profession if we don't speak about Florence Nightingale, well known as the mother of modern nursing and the lady with a lamp, who cared for the wounded and ill soldiers during the Crimean War. During the month of May annually, nurses and midwives throughout the world gather to celebrate and honor her birthday. Florence Nightingale was born on the 12th of May, 1820, in Florence, Italy. She is the founder of professional training for nurses, and she was also a militant for the rights of women and for social justice. Today is our opportunity to join our colleagues to remember Florence Nightingale's life, her achievements, and her contributions to the future of the nursing profession that we are in today. Today, we have 6 speakers who are the nurses and future and midwives of the future to share with us what excites them about the road ahead and the contributions they can play towards a sustainable world. So as we start with the presentations, we have 2 videos that will be played first, and the presentations by the 4 speakers will follow. The first video was prepared by Pavneet Kaur from the University of Hong Kong. Alicia will play it for us. Over to Alicia.
Yes, thank you very much. Let me just share my screen. I think you can all see it. And if you cannot hear the sound, please let me know by giving me an emoji.
Good morning, good afternoon, and good evening, depending on where you're joining from. On this occasion of celebrating nurses and midwives around the world, I'm glad I can join and share some of my most impactful experiences I've had as a nursing student and what the road ahead holds for us. I'm Kaur Pavneet, a final year nursing student at HKU, and I'll be sharing a snippet of my learning journey that motivates me, and it has a lot to do with primary health nursing. What is primary health care and why is it so important? Primary health care is any medical care provided outside of acute settings. It was first recognized in the Declaration of Aljawharah in 1978, and this is the kind of medical care that really embraces the idea that healthcare needs to be a part of everyone's life, and one should be able to access it at any stage of their life. PHC forms an essential part of our system for some compelling reasons. We're all aware of the aging population and how it is to change the trajectory of chronic diseases. Just looking at heart failure alone, while its incidence is slowing down, the prevalence continues to rise due to aging population, and this may be the case for many other chronic diseases. And as PHC has a major emphasis on prevention, high-risk populations can be identified and timely preventive care can be given to them. Another reason why PHC is so important is that it acts as a gateway to secondary and tertiary healthcare systems. so minor healthcare issues can be recognized and cared for in the community, and with a good referral system in place, people who are in need can receive more advanced care in acute settings. Thanks to my practicum placements and my volunteer work, I got to learn about the nurse's role in Hong Kong's primary health care and the impact it has on individuals. In Hong Kong, a prominent infrastructure for primary health care are the district healthcare centers, and these are located in every district, and they help disseminate health information, they hold health talks and classes, and they serve many other functions. In my second year, my team and I delivered health talk for elderly women on osteoporosis prevention. And quite to my surprise, there was a large turnout for the audience, and they were engaged throughout the session. Plus, given the social setting of district health centers, one benefit that these district health centers provide is that they allow the members to interact with one another. That was the outcome of just one seminar, and I'm aware that each district health center has a multidisciplinary team that delivers daily services for members of the DHC. And of course, membership is free and open to everyone. Despite the existence of primary health care being ideal for any healthcare system, there are some gaps. It felt like my journey with PHC came to a full circle this year as I joined the Generations Connect project, with one of the aims being introducing the elderly in Hong Kong that are residing in the community to district healthcare centers and teaching them how to get membership for these centers. But this is definitely not the end for my journey with PhD, as there is still a lot I want to do in the future. While conducting research during my text research internship on migrant women's health, I realized that it is a real challenge to develop primary health care for local populations, but it's an even bigger challenge when the target population are minorities who may be new to the entire system and who may not even speak the same language as us. So, which is why going forward, I'm eager to help develop PhD services for marginalized populations, and I can really see a lot of potential going down this path. Thank you so much for listening to my sharing, and I hope you enjoy the rest of the session.
Thank you so much, Pavneet, for the wonderful presentation. And now we go to the second video, which was prepared by Benjamin Velasquez from the University of Chile. Alicia will also play it for us. And over to you, Alicia.
Sorry, there's actually a slight change. They have a different student presenting. I forgot to tell you. But let me share screen.
A mí me motiva poder entregar los mejores cuidados a las personas, además de ayudarlos también a mejorar su calidad de vida. Y por otra parte también me emociona mucho poder ser parte de la evolución de la enfermería a roles más especializados y de liderazgo, como lo es la enfermería de práctica avanzada. Por otra parte, creo que podemos contribuir a la sostenibilidad del mundo de distintas maneras. Por ejemplo, con la educación, promoción y prevención de enfermedades, desde la investigación, creando y actualizando la evidencia científica, y además también muy importante tomando roles de liderazgo, donde podamos crear políticas públicas que fomenten el acceso equitativo a la salud y que todo el mundo pueda acceder a ella.
Speakers that are in the room. The first speaker is Amishka Singh from the University of Johannesburg. Over to you, Amishka.
Greetings, esteemed colleagues. I am Amishka Singh. I am a final year undergraduate student at the University of Johannesburg, pursuing a degree in a Bachelor of Nursing Science, and will be presenting on behalf of the undergrad team. It is an honor to address you all today on this momentous occasion as we celebrate International Nurses Day. Today we gather not only to acknowledge the critical role that nurses play in healthcare systems worldwide, but also to chart a future of nursing. The future of nursing is a topic that resonates deeply with me, both personally and professionally. My journey into nursing was inspired by a profound desire to serve others and make a tangible difference in people's lives. Growing up, I witnessed firsthand the challenges faced by individuals in accessing quality healthcare, particularly in underserved communities. This fueled my passion and commitment to pursue a career in nursing, where I could contribute in bridging these gaps and fostering a healthier society. As we look towards the future, it is imperative that we consider the broader text in which nursing operates, particularly in South Africa. Our nation has a complex history marked by significant disparities in healthcare access. Under the apartheid government, healthcare services were segregated and deeply unequal, leaving a legacy that still impacts us today. Despite considerable progress, many rural and impoverished areas continue to struggle with inadequate healthcare infrastructure and resources. Particularly, the public healthcare system caters to 83% of the population and is funded by taxpayers, offering free services through primary, district, and tertiary hospitals. However, challenges include shortage of doctors and nurses, resources, infrastructure, thereby leading to poor health outcomes. Whereas the private sector caters to 17% of the population. This system is privately owned and funded through patients paying private medical aid schemes. Generally, facilities are well-resourced, expansive, and world-class. However, this is expensive and inaccessible to the most of our population. This can be addressed by the recent approval of the National Health Insurance Bill, which is South Africa's version of the Universal Health Access, which in its pilot phase, nurses will make up a huge portion of the healthcare staff complement. This historic context is compounded by contemporary challenges, such as the alarming unemployment rates among South African youth. The South African youth unemployment rate stands at a staggering 45.5% as of May 2024, which is one of the highest in the world. However, as of 2022, the South African Nursing Council reported only a 6% of its registered nursing population being under the age of 30. This situation poses both a challenge and an opportunity. The nursing profession globally is recognized for its resilience and demand and offers a viable solution to this crisis. The global employment rate for healthcare professionals driven by aging population and ongoing expansion of healthcare services. In many South African communities, nurses are seen as role models and change makers. Nursing is still seen as an honorable profession. So what can we do to promote nursing as a viable career path and to promote a better future for all? As per the recent South African Nursing Council campaign, we need to #BeThatNurse. By being that nurse means that you are a nurse that wakes up and shows up to make a difference because nursing is your passion. By being that nurse, it means that your actions make others want to be a nurse too. We need to continue being beacons of light within our communities and promoting healthcare and well-being for all through health education measures, family planning, and empowering our communities. To promote a better future for nursing, we focus on the improvement and succession of our profession through vigorous nursing education and training, policy advocacy, collaboration, and international partnership, and through empowerment and leadership. As I have mentioned, I am studying at the University of Johannesburg, which is one of the best universities in Africa according to the Times Higher Education. The Bachelor of Nursing program in General Nursing and Midwifery prepares us to be ready to address the burdens of disease in South Africa and allows us to strive for and adopt best practices and continuous learning opportunities that can empower us as nurses and ultimately empower our youth. Nurses must be at the forefront of healthcare policy advocacy by engaging in policy discussions and decision-making processes. We can share and shape the healthcare system to be more equitable and responsive to the needs of our community as we are hands-on within these communities and are able to understand their collective challenges and needs. Leadership training and mentorship programs can help nurses develop the confidence and skills necessary to drive change and inspire future generations. The future of nursing transcends beyond borders by fostering international...
Amishka, your time's up, actually.
Okay.
Are you almost done? We said a strict
I'm almost done.
cap.
Sorry.
You've already gone 6-7 minutes.
Okay, to conclude, the future of nursing holds immense promise by addressing historical and contemporary challenges we face, particularly in South Africa, and by harnessing the potential of our youth, we can create a healthcare system that is more inclusive, effective, and sustainable. Let us all commit to working together to promote a brighter future for nursing, where every nurse is empowered to make a difference and every individual has access to quality healthcare they deserve. Thank you.
Thank you so much, Amishka, for the excellent presentation. Now we will call upon our second speaker, who is Khalidah Mobarki from the University of Birmingham.
Hi, everyone. Good morning, everyone. My name is Khalidah Mobarki. I'm a doctoral student in nursing at University of Birmingham. It's my pleasure today to join the U21 healthcare group today. I'm excited to discuss end-of-life care, focusing on how it's managed in the Saudi Arabia and UK's, the themes of nursing and midwives of the future. What excites me about the road ahead and contributions can I make toward a sustainable world? Let's explore differences and similarities in these two healthcare systems and their end-of-life care practices. Pursuing a PhD in nursing, enhancing ability, conduct advanced researchers, and contribute to evidence-based practice, influence healthcare policies, thereby elevating the nursing professions and improving patients' outcomes and health quality as well. So what is the difference between nursing system in UK's and Saudi Arabia? In the UK's in general, NHS, which is National Healthcare System, promotes patients' autonomy and evidence-based care, focusing on their individual needs and informed decision-making. In contrast, Saudi Arabia's healthcare system integrated by Islamic cultures, values, and family involvement as well. In care decisions, especially. So Saudi Arabia, as a Saudi students in the UK and studying abroad in many worldwide countries, these cross-cultural experiences enrich my perspectives and enhancing my professional practices, shaping a well-rounded approach to patients' care. So I will focus today specifically in depth, focusing on end-of-life care practice, defined as support for those patients in the last months of years of their lives. What does it mean in UK? End-of-life care in UK, guided by Mental Capacity Act of 2005, emphasizes the patient's dignity and choices and tolerating care to individual preferences. So on the other hand, in Saudi Arabia, is defined as involving, especially in family decisions, is the keys of the aspect, following by Islamic ethics and the value life and community. This approach combines medical practices with religious beliefs, making family involvement very important and enriching. So as international students, I definitely facing challenging, such as language barriers, cultural differences, and end-of-life care. And I view these opportunities to develop my skills in cross-cultural communications and ethical decision-makings. These skills are essentially for any global nursing role over worldwide, enhancing my ability to provide compensated care in diverse settings and see patients from various backgrounds with greater empathy and understanding. Overall, here is my aspirations and opportunities. So my aspirations as a PhD researcher is to bridge cultural gaps in healthcare providers and using my experiences from both UK and Saudi Arabia, and also to enhance end-of-life care for patients and their families as well. So this journey especially is enrich my professional identity and contribute to compensate care globally. So understanding integrating diverse care strategies can make me a significant impact toward a sustainable world in nursing and midwifery. Thank you so much. Here's my references, and here's my bio, which is my expertise in end-of-life care. And thank you all for your attention and giving me an opportunity to share my insights in this event.
Thank you so much, Khalidah, for the wonderful presentation. We really appreciate. And for now, we will continue to call our third speaker, who is Boitumelo Ditshwane from the University of Johannesburg.
Okay, my name is Boitumelo Ditshwane. I'm a PhD student at UJ in Community Health Nursing Science. My passion for nursing, it emanates from the challenges that were faced by people in the community. And as we know, nurses are the advocates to our patients. So the discussion that I'll be doing now is particularly the challenges that are faced by the patient at PHC facilities, particularly men, since as nurses, we are the advocate for patients. So South Africa, can you see the screen properly?
Yes, yes, we can.
Okay. South Africa, yes. The Rainbow Nation. The name was coined by Archbishop Desmond Tutu based on the diversities of the country, such as having 11 official languages, different backgrounds, religions, culture, and traditional practices. In South Africa, the healthcare system still faces a challenge of low usage or poor access to healthcare facilities by men. There are predisposing factors that contributes to low or poor usage of healthcare services by men. And these factors, among others, include culture and tradition and public service providers such as nurses and police. Culture and tradition. Culture poses as a stumbling block for men to seek healthcare. Some cultures, men are taught that they are not supposed to cry because it is a sign of weakness. Also, that when men seek help, it's a sign of weakness. There is even a Setswana as one of the 11 official language. There is even a Setswana proverb that says, "Monna ke nku o lilela teng," meaning that a man is like a sheep and he must cry inside so that he is not heard by others. As a result, these men, even when they are sick, they resort to using traditional medicine, which some of them cause more harm than good. With relation to public service providers, some healthcare facilities prioritize women as opposed to men. For example, you will see services such as mother and child service or a consulting room that is labeled as mother and child. Why not label it as a caregiver and child service? Also, you will hear negative comments such as a nurse asking a man who brought his child to the clinic, "Where is the mother of the child?" which clearly indicates that only women can bring children to the clinic. Equally, when handling GBV cases, priorities are given to female victims as opposed to male victims. Some police, especially men in the justice system, they still mock or do not take seriously a male victim who report a gender-based violence case. They make remarks such as, "Why not handle it like a man?" or are you a coward to allow a woman to hit you? The challenge of low usage of healthcare system might contribute to the SDG goals not being achieved. The SDGs number 3, which is the health and well-being. It's if the challenge of low usage, which contributes to disease spread, outbreaks, and complication persists, then health and well-being will not be fully addressed. The SDG number 7, gender equality. If men are not seen as a priority, then there is no gender equality. The effects of global warming on healthcare system, among many others, it includes more health risks such as stress due to extreme temperatures, communicable diseases such as tuberculosis resulting from greenhouse gases and extreme cold or hot temperature. Anecdotally, men do not handle stress well, and if their stress level is not managed earlier, it might lead to chronic mental illnesses that will require more funding to manage. If these men do not seek healthcare services, contract TB, they might spread the disease, have complications, and end up dying from the disease. My contribution as a nurse to low use of healthcare services will be the development of health policies that will endorse user-friendly services for men, and also the use of social media platforms to promote the seeking of help for men. For instance, we can have a campaign that says, "Stand Up Men." Also, stakeholder engagement at the community level, such as having dialogues and debates to sensitize and encourage men that it's okay for them to cry and seek help. The stakeholder engagement is very important because that's why you will find most men when they are sitting in a kraal, sitting under the tree, and they are also talking about this needs that they come up with. Also, health promotion about home care, such as increased water intake, staying indoors, correct food and medicine storage during extreme temperature will address the issue of heat stress and tuberculosis. So this is how women say thank you in South Africa. The Venda women, you have to sit on the ground and say thank you. So thank you, Enkosi, Nyathokoza, Kialeboha, Roliboha, Danki, Nyabonga, Enko, Mutitumeti, Siabonga. Thank you so much.
Thank you so much, Boitumelo, for the wonderful presentation.
Okay, great. So my name is Aljawharah. I'm a third-year adult nursing student at the University of Birmingham. And I'm excited to share my thoughts on the future and my role in creating a sustainable world through nursing. So what excites me about the road ahead? The future of healthcare is exciting because of all the new technologies and better ways to care for patients. These advancements will help us provide better care and make healthcare more efficient and sustainable. I'm mostly excited about how these changes will improve patient outcomes and make our healthcare system more environmentally friendly, both in the UK and in Saudi Arabia. In terms of the challenges that we have experienced in our studies, one of the big challenges is applying what we learned in classroom to real life situations. It can be tough to keep up with all the medical knowledge and trends, but this challenge also motivates me to learn and grow. Another challenge is overcoming a negative perception of nursing in Saudi Arabia, as many people have outdated views of the nursing profession in Saudi, and it's crucial to change this mindset. To tackle the challenges of applying classroom knowledge to real life situation, we have had an opportunity to practice in different areas at the hospital throughout our placement. And in my own time, I was able to volunteer and attend workshops to also enhance my knowledge. These activities helped me apply my knowledge to real world settings and improve my skills as well. And learning from experienced professionals has also been incredibly valuable. To address the negative perception of nursing in Saudi, I'm committed to becoming a positive role model by demonstrating professionalism, compassion, and dedication. I hope to inspire others and show the true value of nursing. Changing this perception is essential for the future of healthcare in Saudi Arabia. In terms of my decision to become a nurse, it was influenced by several key factors. Volunteering at the elderly center during my high school has showed me the impact nurses can have on people's lives. Additionally, back in 2017, my father had a car accident, and I had the opportunity to experience healthcare from a nursing perspective firsthand. And I saw the compassion and skilled care he received from nurses during his recovery. This made me realize the true value and importance of nursing, as this personal experience has solidified my desire to joining nursing. In the future, I want to contribute to sustainable healthcare by focusing on preventative care, health education, and community healthcare programs. I also hope to engage in research to develop new nursing practices and improve patient outcomes. I also hope, ultimately, I want to be a leader who provides excellent care and mentors future nurses. The journey ahead is full of challenges and opportunities that excite me. By addressing the obstacles in our studies and drawing from our experiences, we can make a real difference in healthcare. As future nurses, we have the potential to transform healthcare and positively impact our community. Thank you for listening.
Thank you so much, Aljawharah, for the wonderful presentation. We really appreciate colleagues. Let's give them a big round of applause for the wonderful presentations that they presented to us this afternoon. It's afternoon in South Africa. Colleagues, from the 4 presenters and the 2 videos, there are a lot of things in common, from the challenges to the possible solutions that our future nurses and midwives has presented to us. The most common thing is access to healthcare, which is a challenge. Almost all the presenters spoke about that. Issues of cultural differences and language barrier. It was cited as one of the challenges. We also had challenges of community members from the primary healthcare settings where they are dealing with gender-based violence and our traditional men who are reluctant to access healthcare. They also cited the issue of global warming, which is the elephant in the room, and low usage of healthcare services due to traditional related issues. So in terms of possible solutions, our future nurses and midwives indicated that involvement in policymaking might solve a problem. Youth empowerment, professional growth, advanced specialization, which is very important within our nursing profession, cultural competence of nurses to deal with with patients from diverse cultures, collaboration internationally to ensure sustainable healthcare provision, inclusivity and working together, which is taking us back to collaboration again, and use of social media platform, which is a very good tool that can be used for today's people. And all these possible solutions might improve patient outcomes. So colleagues, thank you so much. And now is the time for questions and answers.